Today, we are operating on a 69-year-old female presenting with a proximal humerus surgical neck fracture. Because the patient declined open surgery, we are doing close reduction and percutaneous pinning. In this procedure, theater setup is critical for success. The operating room table is kept flat, unlike beach chair position, which is typically used for pillows plating. The C-arm enters from the head end of the table. The instrument trolley and drill are positioned on the ipsilateral side of fracture limb, while the C-arm monitor is placed on the contralateral side for easy visualization while working from the head end. At the end of draping, I prefer to pass a sterile sheath underneath the axilla. This serves as a vital tool to facilitate countertraction intraoperatively. To begin, I insert a K-wire into the proximal fragment. This serves as a joystick to manipulate the proximal fragment and correct the varus deformity. For the reduction sequence, the assistant applies inline traction with the patient's arm held in abduction and flexion. Simultaneously, the proximal K-wire is utilized as a joystick to achieve a satisfactory correction of varus misalignment. Here you can clearly see how we can manipulate the proximal fragment using K-wire joystick. Once an acceptable reduction is confirmed under fluoroscopy, a K-wire is passed from the greater tuberosity down into the medial shaft cortex. A sequential C-arm image should guide the K-wire trajectory in both AP and axillary plane. Next, we proceed with retrograde pinning. Insert K-wire from proximal shaft upward into the humeral head while inserting from the lateral aspect of the shaft. Staying slightly anterior and medial can minimize the risk of injuring axillary nerve. Once the trajectory is correctly verified, a second K-wire is passed in similar fashion. Due to severe osteopenia, the initial GT wire was loose, which was removed, which was replaced by a intermedullary K-wire passing through the greater tuberosity for the stability of the construct. This was our post-operative X-ray with acceptable reduction. Thank you for watching and subscribe for similar more surgical content.